to do the intro. You're listening to 94.4 FM, the Friday sports show for your host, Petruzzi, in New Zealand and around the world. And today we have a very interesting guest. We're going to be talking about a new treatment for people who suffer with IBS. So we've got on the show Dr. Preeti Pandya from Blackpool, registered GP and participant in the IBS study. Anthony Anderson from Sunderland, who's a case study patient, I believe. And I'm not sure, is Professor Peter Whorwell joining us as well? Or
it's just Anthony and Preeti, that's all.
Okay. So yeah, let's sort of find more about this study. Can you give us a bit more of an insight into the to the study and any sort of insights to your experience?
Hi, thank you for having me. If I just briefly mention about IBS, because it's almost 13 million or more people suffer from IBS in the UK, and I would guess this is underestimate because a lot of them don't even seek help. Now, those who IBS is basically a cluster of symptoms. When you go to a doctor, it's a disease of elimination. So we try to rule out other chronic bowel diseases and make sure there's nothing untoward is going on. When we reach to that conclusion, then we decide that, okay, this is IBS. IBS people suffer intermittently or chronically for months, years, lifelong. And it is even the main common symptoms are abdominal pain, bloatedness, diarrhea, and urgency. Urgency where you have to go when you need to go. And this is the most devastating symptom along with severe abdominal pain. This has changed people's life, their social life, they stop doing things, etc., etc. So when these people come to us, the current treatments we have for IBS is mainly painkillers, antispasmodic, anti-motility to stop your diet, and antidepressant. So when I was invited to participate in the Entrose Gel trial for IBS, I was quite excited because rather than shying away when these people come back to see me again and again, and I haven't got anything new to offer, just keep trying different things, it was quite upsetting for me as well that I'm not able to help my patients well. So when we did, because the people, IBS symptoms, syndrome patients, when they seek help, the current treatment, almost 66% said that they didn't get sufficient relief from their symptoms with current therapies. When we did the IBS trial, we had placebo group and the treatment group, and then we also did the second phase where everybody was given Entrose Gel. And the most exciting part was that 76% of these patients reported significant relief in all their symptoms, especially abdominal pain and urgency. And this was game-changing for me in my practice because I could offer something which would help my patients now. If you want to hear a little bit more from one of our patients, you will know how it impacts, and then maybe we can talk about how Entrose Gel works.
Yeah, that'd be great if we could sort of hear. That sounds really interesting. So Anthony, could you sort of give us a bit of an insight into your experience?
Certainly, yeah. I mean, for me, my experience with IBS started as a young child, before I was out of nappies even, according to family. And certainly as a young school child, I would miss time at school. I would be late for school because I was in the toilet. By the time I got to secondary school, I was having to come out of classes. By the time I got to college and university, I was missing days, weeks of time studying. And by the time I was 27, I had actually, my working career had come to a standstill. I'd lost 2 jobs due to IBS. Got to the point where I hadn't left my house in 2 to 3 months at one point. It has a catastrophic effect for IBS sufferers. Certainly I'm at the chronic severe side, but even that stretches into more than likely over 1 million people. And people who are suffering from this, you lose everything. I lost my job, my relationships, my home. I was reliant on my family and friends to go shopping for me, to make me food. As Preeti mentioned about the abdominal pain, it's so severe you can't stand up. You can't go about your day-to-day life. even when you're not at the toilet. And if you're going 20 plus times a day and then having abdominal pains on top, it gets to a point where you just have nothing. Your day-to-day life revolves around just waking up and going to the toilet. Sometimes it would wake me up at 1:30 in the morning, 2 o'clock in the morning, and I'd have to start my day from there. So it got to the point where I had nothing left. And I met a doctor called Professor Yannick at Durham in 2015 who began the trial. And I said to him, look, this is the last throw of the dice for me. The NHS has spent 6 figures on tests and medication that hasn't worked. This is the last option, that I'm going to kill myself. Now that sounds drastic, but as I'm sure Dr. Preeti will reiterate, over a third of patients with IBS have that exact same experience and those exact same thoughts of suicide. So it does have a catastrophic effect. And in 2019, the trial began for Enteros gel, which Professor Yannick had ran. And he got me on the trial, and within a week, I'd started seeing massive improvement. My bowel movements went from 20 plus times a day to 3 or 4, and the pain was almost eradicated. I can eat food again, I can go out. I've had a holiday this year for the first time in 10 years. I've got a career back, got a relationship again. I've regained control of a condition that I had no control about. Now I often think of IBS as almost Russian roulette for bowels. You have no idea when it's going to impact you. I could be teaching a lesson and I'd have to stop and go out to use the toilet. I could be on a bus and have to get off, and if there's no toilet, I've solved myself before on the way to work, for example. And there will be people listening to this who have exactly those symptoms or experiencing exactly that thing. And I would say the first step is you have to go to your GP so they can start the process and make sure that it is IBS, rule out anything else. But what Enteros gel is doing, and Preeti will take you through it more, it's a little gel that you just dissolve in water and drink. I take 2 doses twice a day, so 4 doses. And that has got me my life back. It has been completely life-changing, game-changing as Preeti described for IBS, but for me as a sufferer, completely life-changing.
No, thanks for sharing that powerful story, Anthony. It's really, really powerful stuff. And I've actually received some samples myself, and I don't have IBS myself, but I thought I'd sort of give it a go myself, really. But yeah, can you give us a bit of an insight into how it works, Dr. Preeti? I mean, I sort of read the samples. Really, I'm certainly no medical expert, but yeah, I think you've made some really, really good points. Obviously, about sort of getting checked extensively, and it's a process of elimination, and so on and so forth to get to the diagnosis. But can you give us more of an insight in terms of how it works, please?
Sure. So, yeah, because that's why I feel so excited and feel so privileged to be part of this study. The Enteros gel is actually not a drug. It's licensed as a medical device. And the reason behind, it's an organic mineral. And the way it works is, if you think of a sponge, when you take, it's a tasteless, it is gluten-free, it is dairy-free, it is sugar-free. So you literally mix in a water and just drink it. And when you take it, it goes through your intestine, your bowel, your gut, like a sponge. And while passing through your intestine, it will bind with all the bacterial toxins, viruses, allergens, irritants, whatever it is. It will bind with that and will get eliminated with Enteros gel in your stool. So it kind of cleanses your bowel and it gives relief. That's why we see the patients get good relief and then long-term relief as well. Because it is not a drug, it doesn't have any side effects. It doesn't interact with any other medication if you are on any other medication. It is available over the counter, no problems with safety, because it's been available in the market for 10 years over the counter in the UK and 30 years in Europe. But there are no reported adverse events with this Enteros gel. You can take it as needed as per your symptoms, or you can take it long term. So it's one of the, I would say, very safe, because safety is very important for my patients and for me. Very important that it's safe and you can take it as and when needed. One of the very important points I would like to mention here is that it can be taken from birth. So when your child has a diarrhea where there are no other treatments, like even something we can give to adults, only thing you can give is oral rehydration therapy. Now you can give this to your child as well, which will prevent or reduce the chances of dehydration, hospitalization, duration of illness. I would say that's amazing, because when children gets diarrhea, you don't know how they are going to behave, how long it is going to go on, how severe it can be. So Enteros gel can be used very safely. It's a drug-free treatment. It's available over the counter, but it's available because since we published the data, which was so significant in the International Journal of Gut, now it is available on EMIS. So your GP can prescribe. So if you are having symptoms, go and see your GP, discuss, make sure there's nothing untoward is going on in your bowel. Once they have ruled out, once you are established with the IBS with diarrhea component, you can safely take it, and that I'm pretty sure this will help, will give you significant relief from your symptoms.
Yeah, no, I find that really interesting. Thanks for sharing that. It was, really interesting, really. And I find the sort of case study, the research really interesting. I suppose, it's outside the scope of the interview, but what I found really interesting myself is my area is sort of the field of sort of psychology, and there's a lot been documented over the last few years about the gut and sort of mental health. And I sort of, like I mentioned before, I don't have IBS myself, but I thought I'd try it anyway. So just out of interest, and certainly not prescribing or suggesting anything to anyone listening. But do you think there's scope sort of going forward to look into this like in more detail, Doctor? Do you think there's sort of scope to maybe eventually even look at to see if it has an impact in other areas too?
Yeah. Gut is the cornerstone of our health. So when your gut is not healthy, there is a gut-brain axis, there is a gut-liver axis, there is a gut-skin axis, there is a gut-lung axis. So your gut is extremely important that you look after your gut. There is a clear communication between nervous system of gut and your brain. So our emotional state and gut immune system is very closely linked. So overall, just not IBS, I would say overall, looking after your gut, making sure your gut is healthy, you follow the healthy lifestyle, you try and avoid stress or manage your stress well in your life, you do gentle exercises, all those lifestyle factors are extremely important. But until you get relief from your symptoms, it's very difficult to people, in spite of having all good intentions, to go ahead and do those things. So I would say yes, it's good, and there is a lot of research going on already, and we are also looking into further research in other areas how Enteros gel can help to our patients.
No, that's really fascinating. And just for the listeners, if they want to know more about the study or find out some more information, is there anywhere you can sort of signpost them to maybe look at the study for themselves? I was really fascinated when I read the study myself, but if anyone else sort of wants to have a look and look into it more, is there any way you can sort of signpost and look into it more?
Gel or Entromed website, all the information is there, including studies and publication, etc. You would also find contact details there for various people. So anybody wants to look into a bit more, get more information, absolutely, we would be happy to help. Just go on to the Enteros gel website or Entromed, and they also have a social media sites as well.
Fantastic. No, I really want to thank you for your time, Dr. Preeti and Anthony as well. It's really interesting to have you on board, and thanks again for your time. And I'm certainly going to look into the studies myself. I find this really fascinating as well. So yeah, thanks again for your time, and have a fantastic day.
Thanks very much.
Thank you. Take care. Thank you.